Hello everyone, welcome to another episode where I will pretend to be a doctor this time around and I'm playing this game, the Full Code Medical Simulation. It is quite good actually. I played this game since 2020 during lockdown when I was in first year of medicine, and now that I'm almost done with my medicine entirety, I figured it will be a nice way to go back to this game and play it again. See if I will be good at it or probably quite awful at it. And this game, however, is so incredibly accurate. Wow, I'm quite amazed by the Full Code team. Anyways, for this video, I will be playing any case. Actually, I have already been through all of these cases. By been through, I mean did them multiple times, and yeah, today I will show you how a doctor actually thinks. I'm not a doctor yet, but almost graduated medicine, so I suppose it is only fair for me to know how to manage any patient, right? So anyways, that and all we will see. But for now, however, let's play a random case, I guess, and I believe it will be quite fun. And if you like this video, if you want to be a doctor, if you are planning on becoming a doctor, or if you already are a doctor and if you want to help me with my skills to improve them, well, feel free to comment and I will improve on it, certainly. And if you want to catch a glimpse of how it's like to work for more than 12 hours, 12 to 13 hours a day and not being paid, and then not being paid enough and being generally tired, no sleep, no food, no activities, no fun, nothing. If you want a slice of that, play this game. Anyways, this game has categories all the way from allergy to everything, basically, from basic allergies to cardiovascular, clinical decisions, dermatology, ER, medicine rather, endocrine, environmental, family, GI, hem-onc, infectious disease, inpatient, internal medicine, orthopedics, neuro, OB-GYN, ophtha, ENT, pediatric psychiatry, pulmonary, even rare diseases. Some of them were actually quite interesting. Renal, genitourinary, urology and nephrology, surgery, toxicology, trauma and vascular. So this is, as the game suggests, a simulation. So yeah, let's begin. Okay, so this is a pediatric case immediately. Interesting. So a 10-week-old female coming from home with mom in the ambulance. Her parents called after she appeared limp and looked like she stopped breathing. Vital signs were stable and she slept most of the way without any incident. So the baby seems quite normal from what we can see. The 10-week girl with both parents beside her father drove to the hospital separately. Okay. Unremarkable delivery, everything's on point, all the immunizations. She has no fevers, and she was being fed when she became floppy and looked like she wasn't breathing. And now she is back to baseline. Interesting. Now, this seems like an interesting case, and certainly it will be funny, right? So, not funny, rather it will be. Let's reassure these parents. So let's take this instead of wasting time. Okay, so what I'm gonna do is, well, first get a nice history. So this is a chief complaint: floppy and difficulty breathing. Okay, what? Let's put on a monitor just to track her vitals. I'll mute that. It's gonna get annoying after a while. So yeah. And anyways, so let's begin. So the patient drinking afternoon, mother felt become limp, no vomiting, no seizure-like movements. The patient's mother screamed for her husband. It took them many seconds to come. They will be sleeping as she usually does after eating. And okay, so she has been quite normal and uncomplicated full-term delivery. This is how we get a history from patients. And now we are coming to review of systems. This is quite amazing actually. Review of systems is basically you asking the patient about their systems, basically, like can they see all right, can they hear all right, do they have any difficulty swallowing, do they have any difficulty hearing, is their heart all right, do they have any cardiovascular issues, is their breathing rate, do they feel any sort of breath, do they feel tired, do they have stomach ache, do they have maybe pain while urination in genitourinary neurology, maybe they might be suffering with dementia, memory loss, anything like that, hematologic anemia, weakness, fatigue, all that. So all of these, we can ask all of these in this game. And so you know what, there's the baby is quite stable, so there's no rush, so we can ask all the questions. So as you can see, the patient has no fevers, no abnormal weight loss, no irritability, no conjunctivitis or redness of the eye discharge, no rhinorrhea or runny nose, congestion, otorrhea or discharge from the ears, pus coming out of the ears during infections. No history of otitis. Most of you might have had when you were a child. Breathing, well, it was normal, well, as noted in HPI, so she stopped for a while and then she resumed breathing. Neurologically, everything was fine, and no anemia, no rashes, bleeding, polyuria. Okay, so she seems quite normal and awake, alert, non-toxic appearing, normal tone and activity with strong prion examination. So this patient is quite stable. Anyways, it's normal. Anyways, but there is no problem with actually doing a complete physical exam just to be safe, because the patient is how old? 10 weeks. Yeah, it's better to do everything just so that we can rule out any unnecessary or any missed diagnosis rather. So her airway is patent. So by patent airway, they mean her airway is stable, she can breathe, there's no obstruction. Or stridor, as in whistlings. And breath sounds, they're bilateral symmetric breath sounds with normal chest rise. That's how it's supposed to be, bilateral, because we have two lungs, and symmetric breath sounds because you breathe through both the lungs at the same time. So your chest rises and depresses at the same rate. 2 plus peripheral pulses. Peripheral pulses are graded on a scale, so 2 plus means quite normal, and normal pulse, strong pulse, normal strong pulse, and normal capillary refill. Capillary refill is the amount of time it takes for your capillaries or the small little blood vessels to get filled up with blood. So this is where the doctor will probably, you can do it on thumb or you can do it on your feet as well. Just press on the nail bed, your nail goes white. Then if you leave it, just look at the time it takes for it to become red again. It should take around 2 seconds. So if it is around 2 seconds, that's normal. If it is longer than that, then probably you have to get checked out. And although it depends, if you are living in a colder environment, it will take a while. And so yeah, there's the HEENT, head, ears, nose and throat and all that. So the patient is normocephalic, so the head is quite normal. There is no deformities, atraumatic, no fontanelle bulging. Fontanelles, they are the little soft spots that you can feel at the top of the head in babies. You can see them in. Can I get a better view of the baby? Well, not anyways. So here you will find the fontanelles in the middle of the head. If you push in the middle of the head, especially in infants, you will feel that they are quite soft and it's quite squishy, and the skin can go inside. The skull is not fully developed over there. A bulging fontanelle can basically suggest any type of infection or inflammation of the brain, like meningitis. So yeah, meningitis, hydrocephalus, where there is increased pressure in the head. It can be congenital. So yeah, and intracranial pressure generally increases the pressure inside your head. It can increase during infections, like as I said, meningitis. So yeah, head circumference is within normal range for age, so that's fine. No masses, trachea in midline, full range of motion, so the neck is alright, heart is alright, no venous bronchi, rails, normal rate and rhythm, soft, non-distended and active vowel sound, so normal, normal labia and introitus, well, the genitourinary system is normal. Back, no deformities like scoliosis or anything like that, or any, yeah, basically no scoliosis or any other abnormal curvature, let's just say. A musculoskeletal, there is no cyanosis or bluish limbs and lips. They become blue when they are deprived of oxygen. Edema, when there is too much fluid. You might have seen this in patients with heart failure, yeah, or patients in kidney failure. They retain a lot of water and their bodies and face will all get puffed up. So yeah, normal tone. So the hand does move. The hand or muscles for that matter move normally when they are relaxed, as in you can passively move the hands. So basically there's that. So, normal tone, as in you can move them properly. If you hold a person's hand and if you shake it, it shakes normally. If you leave it loose, it is basically the resistance to movement. So if you have something like contractures, maybe from burns, the joints or something, the skin becomes stiff, well, you can't move their arm anymore, the joint anymore, and that is increased muscle tone. So this is normal tone. So the hand is floppy and it has some resistance in it when asked to live relaxed. So good. And skin is warm and dry with no rashes. So that's good. Sleeping but wakes up during the exam. That's also quite good. Focus on the mother, smiles at parents. Yeah. And all that. And intact motor reflex. Now, what is a motor reflex? Well, it basically is the reflex where if you drop the baby, hold the baby up from the bed and drop them, they will flop their hands. They will, when falling, I'll put a picture up during editing so that you will know what I meant. And intact motor reflex is quite good. It's a sensation of falling. It's body's reaction to falling. So yeah, in adults, if motor reflex does occur, that means, oh yeah, they have brain damage. Anyway, so there's nothing in the physical exam. Her vitals, they're normal. So yeah, I don't see any reason why we should keep this patient here. So patient is normal, I suppose. So we can communicate with the parents. Pediatrician? Should we call in a pediatrician for this case? Not really. Nah. I believe we can put the baby in brief observation. Maybe if the thing repeats itself again, and I suppose it is an unexplained event. So yeah, I can ask the attending physician for helping with diagnosis, key actions, advice on reviewing systems, advice on exams. So the game does give you hints, and I'll ask help me with the diagnosis so that I will get a bunch of differentials. So these are all the cases that could have been for this patient. So Anyways, Munchausen's by proxy, well, child abuse, when the mother decides that the baby needs help by herself and causes harmful interventions to the baby while the mother is suffering, mother or the parent rather, is suffering from psychological disorders, basically, let's just say. GERD, reflux, gas, all that. Non-accidental trauma and neglect. Child abuse again, so that's not the case here. Brief, unexplained, resolved, event, whatever. Yeah, it is termed as acute life-threatening event. Describes an event that is younger than 1 year, age lasts for less than 1 minute, and there could be cyanosis and all that, but it comes back after a while. So it is all spontaneously, and exam and vital signs are normal. So I think this is what the patient has. Hydrocephalus, as I said, is pressure inside your head because of too much cerebrospinal fluid, the fluid where your brain floats. Breath holding spell, it does happen. These are not intentional, they resolve spontaneously. As it's a simple seizure, no, the patient did not complain of any seizures. Foreign body obstruction, there was no stridor or whistling sound. Upper respiratory tract infection, well, the temperature is normal. So, yeah, the best diagnosis is a brief, resolved, unexplained event. So, finish. Right, what happened? Yay, done. See? Very good. Done. So, you know what? Let's get another random case. 2 cases per episode? Yeah, why not? Okay, so now this is quite amazing. Now this is quite fun now. It's getting to a point where the things are going to get tricky. So there's a dropped off by a friend, 19-year-old male with shortness of breath, perioral cyanosis, oxygen applied, and direct to resuscitation. So perioral cyanosis, or basically blueness around the mouth. Okay, so direct to resuscitation. Why resuscitation? Anyways, let's see. Okay, difficulty breathing. So yeah, thank you. I know you're there for help. Let's attach a monitor first and an IV. Okay, so the oxygen saturation is in the 70s. As a rule of thumb, what I do is, if the patient has difficulty breathing, or if the oxygen saturation if the patient is unconscious, or if the patient is unconscious and has oxygen saturation O2 of less than 90 rather, I generally intubate the patient in this game. But although of course 73 is quite severe, so we might as well do that. So intubation or placement of an endotracheal tube. So first we have to lay the patient flat, endotracheal tube, suction out all the fluids inside the throat and mouth so that the patient doesn't choke on them or aspirate them, and then we pre-oxygenate with non-rebreather mask. And of course, intubation, it involves shoving a tube down your throat, so obviously you have to sedate the patient, and for that I will use etomidate and rocuronium. Etomidate and succinylcholine, etomidate, rocuronium, anything works. Etomidate is an induction agent, it causes the patient to pass out, and rocuronium is a paralytic agent. It paralyzes the trachea so that the person doesn't breathe on their own anymore, so that placement of the tube will be easier, the trachea will be straight and easy to place. But first, before we do that, let's perform ABCs. The most important thing that you have to perform on the man: airway, breathing, circulation, bounding peripheral pulses. So yeah, peripheral pulses are too strong while there is nothing in the head and neck and face and all that. Fingertip cyanosis, petechiae, rashes and all that. Okay. Reports fever 101 and felt unable to catch his breath. This is not how you do it actually, because this patient is quite unstable. I just started with this, but no, this is not how you do it. You first start with history and then physical exam. But for now though, so patient is vaping, patient vapes a lot. Don't do vaping. And nicotine containing products 5 to 10 times a day, and THC containing products 2 to 5 times a day. Wow, he is on some strong drugs. Well, you know what? It's not our role as a doctor to judge a patient's poor choices. Well, I mean, you know what I mean, don't you? Yeah, yes. So let's intubate this patient for now. So we'll see. Let's not keep him waiting for too long because 72% saturation is good. And so they did. Yeah, look at that. That's the ventilator machine. So the oxygen saturations are back to normal now, which is good. So what do we do next in this patient? For now, the patient is stable. Should we give them fluids? Honestly, why am I struggling with this? Why am I struggling with this? Is the patient complaining of fever? Yeah, fever last night. So there could be an infection in this. You know what? First, let me place an. It's been a while since I played this case. It's been maybe 2 years already. So I don't remember what's in this case. So yeah. Anyways, you have to place an orogastric tube so that you can decompress the stomach, prevent aspiration. It can also be used to provide nutrition. So that I can do. And analgesia, of course, you have to keep the patient anesthetized. So I will give propofol. Keeps the patient from waking up again. Ongoing sedation and pain relief. So I suppose that's good. Perform and okay, so let's investigate. Let's do an ECG. Get a baseline ECG. Any person struggling with breath should get an ECG because it could be a problem with the heart. Blood sugar, why not? It's quite obvious. Get a blood sugar always. You're already there, so why not get a blood sugar? Basically, you should, of course, get a lung ultrasound. Maybe, you know what, I'll directly get a chest ultrasound. So, X-ray chest. Sorry, chest X-ray. Chest ultrasound. Really? Did I say that? Yeah. Okay. Ignore me. Ignore what I just said. And here, of course, we'll first get an EBG because the patient had low saturation for a very long time. And basic chemistry means electrolyte replacement, of course, if the patient has any deficiencies in electrolytes. Blood type and screen, nah, not really. We're not sending this patient to a operation. So, yeah. CBC, of course, lactate. It gives us a value of tissue oxygenation perforation. So, perfusion, not perforation. So, perfusion as in how much the blood is actually flowing. The blood is reaching every single organ, basically. So, elevated lactate levels can be seen in hypoperfusion. Could be the case in this patient, such as hypovolemia, cardiac failure. So, yeah, let's see. We can also do an ABG, CBC, yeah. Lipase because pancreatitis. Yeah, because why pancreatitis? Forget that. Anyways, so why am I thinking pancreatitis in this case? So let's get an urine analysis, of course, to get all the different infection levels. Troponin T because the patient had difficulty breathing, so it is appropriate to get a cardiac investigation done. So ProBNP is more acute cardiac marker and is one of the best ones actually. Other labs, urine toxin because this patient is like smoking, so yeah. Alcohol levels, of course. What else? Do I need to get anything else in this patient? COVID-19? Nah. Now let's perform an investigation and let's see what it says. ECG, okay. Sinus tachycardia. So, yeah, ECG is normal. Patient is having tachycardia. It could be an effect of THC. So, marijuana, THC, there you go. It is positive. Oh, wow, the lungs. Pulmonary infiltrates consistent with ARDS. I see, the patient is struggling with breathing because his lungs are quite damaged, badly damaged. So, what can we do for this patient? Let's see what other values suggest. Bicarb is elevated, WBCs are elevated. Although we can't get a differential count in this patient, but you know what, it is quite normal to get a complete antibiotic coverage, so bacterial coverage. So I will provide a broad spectrum antibiotic in this patient. Patient had fever, everything. So it could be infectious cause, and looking at the lungs and the fever, it could be pneumonia. So let's give this patient vancomycin. Vancomycin. So this will cover gram-positive infection, endocarditis, infection of the heart, meningitis, C. diff, piperacillin, tazobactam, sepsis. Could be actually, we can do that for sepsis as well. And the patient also is suffering with slightly elevated heart rate, so tachycardia, fever, low blood pressure, although not quite as low but still normal. But you know, in young patients, especially 19 years, your body can decompensate, like your body can compensate for any loss in volume, let's just say. So yeah, and yeah, let's give this to the patient. So let's communicate with ECMO team. Obviously this dude is quite serious now. Okay, that's that done, and there's nothing else you can do really. The patient is quite badly, yeah. So anyways, the patient has transitioned to using vape, and last year vapes, nicotine and THC. So probably the patient inhaled some of the nicotine or vape or THC, whatever it is in it. Actually, I don't do drugs, so, and he does endorse a chronic cough due to smoking. So yeah, I think the smoke has damaged his lungs, and now he is in a very serious state. See, this is why you don't do drugs. Did we miss anything? 18 out of 24 recommended. So we did everything, but we are missing a few things that can be done. So what did we miss now? Does it matter? I don't think so. I got my diagnosis. It is lung damage due to vaping, and this is what we would term it as acute respiratory distress syndrome. So we know that the patient should be admitted to ICU, and it says there are how many? 2 correct diagnoses. I suppose, yeah, vaping associated pulmonary injury is one of the diagnoses, and this also led to acute respiratory distress. Yes, it did. Should we admit the patient to ICU? Yes, we should. Okay, so finish. Yay, 100% yet again. Probably I'm not a bad doctor. Probably I'm not. Anyway, so I guess that concludes the game for today, and probably another episode of this game will be released soon. And until then, goodbye.